Which equation is used by perfusionists during CPB to continuously calculate the rate of oxygen delivery to tissues? A. Do2 equals CO times 1.34 times HB times SAW2 plus 0.003 times POW2. B. VD/VT equals POCO2 PeCO2 / POCO2. C. MAP equals 2 times DBP plus SBP /3. D. FIC equals VO_2 / CHOW_2 CVO_2. Answer. A. Do2 equals CO times 1.34 times HB times SAW2 plus 0.003 times POW_2. Explanation. This is the standard oxygen delivery equation, where cardiac output, CO, is replaced by CPB pump flow rate. Ensuring that Do2 remains above critical thresholds, typically greater than 260-300 ml/min/m², is a primary goal to avoid anaerobic metabolism and acute kidney injury on bypass. In a standard roller pump, what is the specific function of the backing plate or raceway? A. It acts as a safety shield to catch blood spills. B. It is the curved track against which the pump rollers compress the silicone/PVC tubing to push blood forward. C. It regulates the temperature of the passing fluid. D. It monitors the pressure inside the oxygenator. Answer. B. It is the curved track against which the pump rollers compress the silicone/PVC tubing to push blood forward. Explanation. The roller pump works via peristalsis. The flexible tubing sits inside a precise, curved metal track called the raceway or backing plate. As the rollers spin, they trap and squeeze fluid between the roller head and the raceway, forcing it forward. What is the fundamental difference between standard veno-arterial (VA) ECMO and a standard CPB circuit setup? A. VA ECMO does not use an oxygenator. B. CPB strictly includes an open venous reservoir and a cardiotomy suction system to handle shed surgical blood, whereas ECMO is a closed circuit. C. ECMO uses bubble oxygenators while CPB uses membrane oxygenators. D. CPB does not utilize any systemic anticoagulation. Answer. B. CPB strictly includes an open venous reservoir and a cardiotomy suction system to handle shed surgical blood, whereas ECMO is a closed circuit. Explanation. CPB is an open circuit meant for short-term operating room use, featuring a large open reservoir to catch vented heart blood and surgical field suction. ECMO is a closed loop, no open reservoir or cardiotomy vents. Designed for days or weeks of respiratory/circulatory support in an ICU setting, minimizing the air-blood interface to reduce clotting and inflammation. If a perfusionist observes a sudden drop in systemic arterial line pressure but the arterial pump flow rate remains unchanged, what is the most likely cause? A. Direct kinking of the arterial cannula. B. A sudden, severe drop in the patient's systemic vascular resistance, vasoplegia. C. Clotting inside the oxygenator fibers. D. The venous reservoir running dry. Answer. B. A sudden, severe drop in the patient's systemic vascular resistance, vasoplegia. Explanation. Because the pump flow is constant, acting as a fixed output system, pressure is determined by vascular resistance. Pressure equals flow times resistance. A sudden drop in pressure without a drop in flow implies profound systemic vasodilation, often triggered by inflammatory cytokines or the initiation of warm blood flow. What is the primary purpose of utilizing an aortic cross-clamp during standard CPB? A. To completely cut off blood supply to the brain. B. To isolate the coronary circulation from the systemic circulation, allowing cardioplegia to achieve a still, bloodless field. C. To increase the overall flow rate of the centrifugal pump. D. To prevent blood from draining out of the right atrium. Answer. B. To isolate the coronary circulation from the systemic circulation, allowing cardioplegia to achieve a still, bloodless field. Explanation. The aortic cross-clamp is placed across the ascending aorta between the arterial cannula injection site and the coronary arteries. This allows the body to stay fully perfused by the machine while the heart is completely isolated, stopped with cardioplegia, and opened safely by the surgeon. During the weaning process from CPB, why is it critical to systematically vent the aortic root and left heart chambers before the heart is allowed to eject blood? A. To maximize systemic vascular resistance. B. To prevent catastrophic systemic air embolization to organs like the brain. C. To cool down the coronary arteries. D. To ensure the heparin is fully metabolized before stopping the pump. Answer: B. To prevent catastrophic systemic air embolization to organs like the brain. Explanation: when the heart is opened for surgery, air enters its chambers. Before the cross-clamp is removed and the heart begins pumping on its own, all air must be aggressively aspirated, vented, out of the apex and aortic root to ensure air pockets aren't pumped into the systemic circulation, causing a stroke. What physiological phenomenon occurs when blood interacts with the synthetic polyvinyl chloride, PVC, surfaces of the CPB tubing? A. Immediate degradation of all red blood cells within 30 seconds. B. Universal upregulation of the immune complement cascade and leukocyte activation. C. Instantaneous drop in body temperature to room temperature. D. Total suppression of the body's baseline inflammatory pathways. Answer: B. Universal upregulation of the immune complement cascade and leukocyte activation. Explanation: the human body recognizes the vast plastic surface area of the CPB circuit as a massive foreign object. This triggers an intense whole-body systemic inflammatory response syndrome, SIRS, activating the complement system, platelets, and white blood cells. Why do centrifugal pumps require an electronic flowmeter on the arterial line, whereas roller pumps can calculate flow based purely on RPM? A. Centrifugal pumps are highly occlusive and compress the blood manually. B. Centrifugal pumps are load dependent. Their flow varies based on downstream resistance and upstream preload. C. Roller pumps cannot measure speed accurately. D. Centrifugal pumps only run at a single constant speed. Answer: B. Centrifugal pumps are load dependent. Their flow varies based on downstream resistance and upstream preload. Explanation: roller pumps push a fixed volume per revolution regardless of resistance, displacement pumps. Centrifugal pumps rely on kinetic energy and are non-occlusive. If resistance increases downstream, e.g., a kinked line, the pump spin will continue but flow will drop or stall completely. Thus, an external electromagnetic or ultrasonic flowmeter is mandatory. What is a leukocyte depletion filter, sometimes utilized for in a CPB circuit? A. To extract extra clotting factors from the prime solution. B. To filter out white blood cells from the circulating blood to mitigate post-bypass reperfusion injury and lung damage. C. To actively increase the patient's hematocrit. D. To separate plasma from packed cells during rapid transfusions. Answer: B. To filter out white blood cells from the circulating blood to mitigate post-bypass reperfusion injury and lung damage. Explanation: activated white blood cells, leukocytes, release destructive enzymes and free radicals that drive tissue injury during reperfusion. Incorporating a leukocyte filter selectively traps these activated cells, reducing lung injury and total body inflammation. What is the standard target core temperature for a patient undergoing deep hypothermic circulatory arrest, DHCA? A. 34 to the power of C to 36 to the power of C. B. 30 to the power of C to 32 to the power of C. C. 18 to the power of C to 22 to the power of C. D. 5 to the power of C to 10 to the power of C. Answer: C. 18 to the power of C to 22 to the power of C. Explanation: DHCA is used for complex surgeries, like aortic arch repairs, where the blood flow must be stopped completely. Cooling the patient down drastically to 18-22°C safely decreases cellular metabolic rate and protects brain and organ tissue from ischemia during the period with zero blood circulation.